All right, let's talk about the elephant in the room.
This is why my chiropractic colleagues should stop cracking necks. I explained why exactly 1 year ago after this young woman was paralyzed.
So today we're going to be talking about whether or not chiropractors should continue the practice of manipulating the cervical spine. One of the notions that I keep seeing being thrown around is that there's no data to support the use of cervical spine manipulation. As someone who has been very vocal about the overutilization of cervical spine manipulation, I don't like this point. The reason is because this argument is actually pretty weak. There is in fact data to support the use of cervical spine manipulation. Whether or not you want to critically appraise that data and say that data is of weak clinical value is another discussion altogether. That doesn't take away from the fact that these studies exist. The real question consists of two parts. Number one, does cervical spine manipulation confer any unique treatment benefits? Number two, according to a risk-benefit analysis, do the benefits of cervical spine manipulation outweigh the potential harm? Now, this is the crux of the argument. This is where things get granular, and this is where we have to utilize a little bit more nuance. So now, in an effort to be the most evidence-based providers as we can be, we have to look at what the evidence seems to suggest, while also simultaneously contending with the plethora of anecdotes that exist about the ramifications of cervical spine manipulation. So let's contend with the first part of our clinical question. Does cervical spine manipulation seem to confer any unique treatment benefits? Well, according to these studies right here, there appears to be a myriad of other interventions that confer the same benefit as cervical spine manipulation. Those other interventions that seem to confer the same benefits also don't seem to carry the same risk for catastrophic adverse events that cervical spine manipulation seems to carry. Those catastrophic adverse events being cervical artery dissection, strokes, and potentially even death. All that being said, it's now pretty easy to answer whether or not cervical spine manipulation seems to confer any unique benefits. The answer is no. So that just leaves part two of our question now. Is the risk for cervical spine manipulation worth it? So as far as we can actually tell right now, the risk for developing a cervical artery dissection, a stroke, or dying post-cervical manipulation done by a chiropractor is actually very low. However, and this is a big however, this phenomenon amongst the population itself is very, very rare. That makes it incredibly difficult to study. In fact, the rate for cervical artery dissection appears to be 4.69 per 100,000 person years. Other studies seem to show that the rate of cervical artery dissection is 1 in every 100,000 people. In studies looking at cervical artery dissection after chiropractic manipulation of the cervical spine, the rate appears to be anywhere from 1 in 20,000 treatments to as low as 1 in 2 million treatments. Now, staunch proponents of cervical spine manipulation will point to data that shows that the forces applied during cervical spine manipulation aren't higher than forces that are applied to the neck during routine everyday movements of the cervical spine. That said, one of the best papers on this phenomenon done by the American Heart Association and the American Stroke Association showed that patients were 5 times more likely to suffer a cervical artery dissection 1 week after going to get a cervical spine manipulation by a chiropractor. So where exactly does this leave us in the clinical decision-making process? Well, on one hand, it appears that chiropractic cervical spine manipulation doesn't confer unique treatment benefits compared to other things that appear to have less risk. It would also seem that the likelihood that someone suffers from a cervical artery dissection after a chiropractic manipulation is rare, with the caveat being that this phenomenon is so obscure that it's incredibly hard to study. And that leaves us to contend with the overwhelming anecdotal evidence that chiropractic manipulation of the cervical spine might be correlated to an increased rate of cervical artery dissection. Even if it's not causative, there still appears to be a link. And when we're talking about something that's as detrimental and potentially life-threatening as a stroke, those things need to be taken into consideration. Now, before I give my own opinion on whether or not I think chiropractors should continue the practice of cervical spine manipulation, I want to go over something that's very important and not talked about enough, and that is informed consent. So a medical informed consent is basically where the practitioner tells the patient about the risks associated with the procedure, the benefits associated with the procedure, and what will happen to the patient if they don't deploy any interventions. Giving the patient a thorough informed consent is basically walking them through their own risk-benefit analysis and arming the patient with enough information that they can make an intelligent decision about their own health. Anecdotally, I found that when we go through our informed consent, 9 times out of 10, my patients don't want to get their cervical spines manipulated. And because there are so many other things that allow me the same clinical benefit as cervical spine manipulations, it doesn't take away from my clinical practice whatsoever. But because we're taking real life into account here, there are patients who have had a long positive history with chiropractic cervical spine manipulations who expressly want that treatment. So here are the conditions where I think cervical spine manipulation is okay. Not mandatory, not recommended. It is a begrudging okay. If therapeutic exercise / physical therapy has failed, if soft tissue therapy such as massage has also failed, if Maitland mobilizations 1 through 4 have failed, if your patient doesn't currently suffer from and has never previously suffered from high blood pressure, double vision, syncope, migraine headaches, and I really hope these are obvious, cervical artery dissection, strokes, transient ischemic attacks. Is that all? I think that's all. If you've done all of that and you've gone through a thorough informed consent with your patient and they've had a prior positive experience with cervical spine manipulation, then I suppose it is okay to manipulate the cervical spine. I wouldn't advise it, and I'd recommend you do everything else beforehand. But at the end of the day, your patient is a grown, consenting adult. And if you're comfortable with performing the manipulation and they're comfortable with receiving the manipulation, that is on the both of you.